Echinococcus species. Adult Echinococcus granulosus found in the small intestine of dogs. Final host. And hydrated cyst mainly in liver and lungs of intermediate host. Scolex has rostellum which is armed with two rows of hooks. Adult worm usually contain 3 or 4 proglottids, rarely up to 6. Bilobed ovary is kindly kidney shaped. Bilobed ovary is kidney shaped. Terminal segment is gravid and is usually about half of the total length of the worm. Gravid proglottid usually disintegrated in the intestine so that only eggs and not proglottid are found in the feces. Final host dog get the infection by the ingestion of hydrated cyst infected meat, whereas intermediate host get the infection by the ingestion of egg during grazing. Echinococcus species Cestodes, hydrated cyst which found in different organs like liver, lung mainly, and also in heart, kidney, and brain etc. of intermediate host. Hydrated cyst is surrounded by a fibrous wall of the host and contain two walls derived from the parasite, example an outer laminated membrane, and within this is a granular germinal membrane. Blood capsule develop from the germinal membrane. Blood capsule when detached and float freely in the cyst fluid is called hydrated sand. Hydrated cyst structure. The hydrated cyst has three layers. The outer pericyst composed of modified host cell from a dense and fibrous protective zone. The middle laminated membrane, which is acellular and allows the passage of nutrients. The inner germinal layer. C is inner germinal layer. Echinococcus species, final host, intermediate host, disease distribution. Echinococcus granulosus, canids, anthelid, hanids, ungulated and man, cystic echinococcosis or unicellular echinococcosis or cystic hydrated disease. Worldwide distribution. Echinococcus multilocularis, fox, dog, cat, rodent, alveolar echinococcosis or multilocular echinococcosis or alveolar hydrated disease. Northern hemisphere primarily. Echinococcus vogeli, brush dog, South American rodent, polycystic echinococcosis, Central and South America. Echinococcus oligogastrus, wild-bellied rodent, polycystic echinococcus do. Echinococcus granulosus, final host, dog and wild canine, intermediate host, ruminant, pig, camel host, man, etc. Metacystode larval stage, hydrated cyst, transmission of infection, final host gain infection by the injection of raw or undercooked meat containing hydrated cyst. Intermediate host get infection through contaminated water or forage with egg or E. granulosus. Men, especially children, get infection during founding with infected pups. Life cycle of E. granulosa. Life cycle of E. granulosus. Egg of E. granulosus passed with feces of infected dog. Intermediate host get the infection by the injection of egg along with graces during grazing or drinking egg contaminated water. Oncospore from the egg come out in the intestine and penetrate the intestinal wall with the help of their hooks. Through blood circulation is rich in different organs like liver and lung mainly. Her oncosphere transform into the fluid-filled cyst, example hydrated cyst. Hydrated cyst become mature in 6 to 12 months. Final host dog etc. get infection by the injection of hydrated cyst. The wall of cyst digested and the scolex are released in the small intestine and become adult 40 to 50 days after infection. Life cycle or E. granulosus, Echinococcus granulosus. Pathogenesis of Echinococcus. Pathogenesis of Echinococcus. In heavy infection, adult Echinococcus granulosus may cause enteritis in dog final host. In domestic animal, intermediate host clinic signs are not usually seen even in heavy infection. In intermediate host, the pathogenicity due to hydrated cyst depended upon the size, number, and location of the cyst. Hydrated cyst may cause pressure atrophy of the affected organs, which lead to hamper the function of affected organ. The rupture of hydrated cyst may give new daughter cyst in organs. The leakage of hydrated fluid can lead to various allergic manifestations like urticaria, asthma, and fetal anaphylactic shock, and even death of the infected host. Pathogenesis of Echinococcus hydrated cyst in liver. Diagnosis. Diagnosis. It is very difficult to differentiate the egg of Echinococcus from other tennid eggs. Therefore, a dog must be purged with ericoline hydrobromide 1 2 mg per kg and the mucous portion of the purgated material examined for minute adult E. granulosus. By serological tests like complement fixation test, CFT, ELISA, Cassonil test, etc. Hydrated cyst fluid contain two major antigen, example ARC5 and antigen B. Within the help of radiography like X-ray, ultrasonography, computed tomography, CT scan, MRI, etc. Postmortem examination to detect the hydrated cyst. Treatment. To final host, ericoline hydrobromide 1 2 mg per kg body weight orally is highly effective. Addition of sucrose is recommended to avoid the bitter taste. Praziquantel mg per kg body weight orally. For intermediate host, first surgical removal of the cyst. Second, but is very risky if cyst is ruptured, then anaphylactic shock may be noticed, or if the remnant of the cyst or cystic layer is left, a new cyst will be developed again. Some drugs are also effective up to certain extent. Albendazole 10 to 20 mg per kg body weight oral per day for 1 month, even more. Praziquantel 5 mg per kg body weight orally. Control regular deworming of dogs by providing cooked meat to the dog. Dogs should not allow to defect in the park, vegetable garden, and in the grazing field used by farm animals. Destruction of caging of stray dogs. Man should wash the raw vegetable and fruit before eating. Poultry tapeworm. Poultry tapeworm. Poultry tapeworm. Poultry tapeworm. Davinia, Relitina, Cotugnia, Amabotania, Cognotania, Conotania, Hymenolepsis. Family Davinidae. Family Davinidae. Family members have retractable rostrum and armed with one or more circles of hammer-shaped hook. Metacestode bladeworm, cystosarcoid. Eggs are enclosed in a capsule in gravid proglotid. Davinidae cestode. Species, final host, intermediate host, location. Davinia proglottina, fall, gastropod, mollusk, Agriomilax, etc. Duodenum, Relitina, tetragona, fowl, and Fidol, tetramorium, etc. Small intestine. Retilina echinobothridia fowl and Pleidol tetramorium etc. small intestine. Retinina cesticillus fowl beetle Tribolium anticus etc. small intestine. Davinia proglotina. Davinia proglotina. Morphological characters, location, duodenum, microscopic adult with only 4-9 proglotid, 0.5 to 3 mm length, smallest cestode of poultry, retractable rostrum and sucker arm with hammer-shaped hook. Hook are loosely attached and easily lodged during handling. Egg in the gravid proglotid lies single in a capsule. Davinia proglotina. Cysticercoid larvae develop in gastropod mollusks, agri or limax reticulates. Smallest known 0.5 to 3 mm in length, tapeworm with only 4-9 proglotid. Fowl get the infection on the ingestion of cysticercoid infected mollusk. Life cycle of Davinia proglotina. Life cycle of Davinia proglotina. Pathogenesis and symptoms of Diproglotina. Davinia proglotina is most pathogenic cestode of poultry which cause necrosis and hemorrhagic enteritis. Heavy infection may be fatal. Symptoms: chronic infection result reduced growth rate, emaciation and weakness. Relatina tetragona. Morphological character: local posterior half of the small intestine. Cosmopolitan distribution. Scolex is smaller than R. Echinobothridia. Rostrum is armed with one or two rows of hooks, about 100 in number. Relitina tetragona. Morphological characters: common, largest up to 25 cm in length, and less pathogenic species of tapeworm in birds. Each egg capsule containing 6 to 12 eggs. Final host get infection by the ingestion of cysticercoid infected ant. Relitina echinobothridia. Morphological characters: common name, nodular tapeworm of poultry. Location: small intestine. Rostrum is armed with two rows of 240 to 264 hooks. Gravid proglotids frequently separate in the middle, forming a small window in the strobila. Relitina echinobothridia. Pathogenesis and clinical sign. It is most pathogenic among Relitina species since the parasite form various nodules at the site of attachment in the intestine, nodular stenosis. It may cause hyperplastic enteritis. Infection result weight loss and decreased production. Morphological characters: commonest tapeworm of domestic poultry, largest scolex with a wide rostrum armed with 400 to 500 hooks. Suckers are inconspicuous and unarmed. Egg lies single in a capsule. Final host gets the infection by the injection of cysticercoid infected intermediate host, example beetles, Tribolium anticus, etc. Gravid segments are usually voided in the evening time. Cotugnia diagonophora. Cotugnia diagonophora. It is commonly called double pod tapeworm of poultry. Location: small intestine. Rostrum bears two rows of small hooks and the suckers are unarmed. Two sets of genital organs per proglotid. Cotugnia diagonophora. Cotugnia diagonophora. Proglotid have bilateral genital pore and one egg per capsule. And Monomorium scabricell and Gracilium etc. act as intermediate host. Conotaenia infundibulum. It is found in small intestine of fowl and turkey. Morphology: rostrum armed with 60 to 20 slender hooks. a segment wider posteriorly than anteriorly and giving a characteristic shape. Genital pore alternate regularly. Cornotinea infundibulum. Cystosarcoid larvae develop inside intermediate host. Example: housefly, Musca domestica, and beetles. Eggs have distinct elongated filament. Graved segment usually voided in the morning hour. Amoebotinia cunita, a sphenoid found in small intestine of domestic fowl, small cystode up to 4 mm long and roughly triangular in shape. Rostrum armed with rose-thorn-shaped hook. Genital pore usually alternate regularly at the anterior end of the proglottid. Life cycle of a cuniata. Domestic fowl get infection by the injection of cysticercoid infected earthworm, Escherichia ferretina, etc. Symptom of A. cunita and C. infundibulum. Infections are moderately pathogenic in most cases affected but do not show serious clinical signs. Heavy infection can cause reduced growth, enteritis, diarrhea, hypovitaminosis B, especially in young birds. Affected bird can become apathetic and isolated. Incidence and symptoms of poultry cystode. Cystode infection in poultry are known to cause retard growth, diarrhea, enteritis, hemorrhages, and hypovitaminosis B. Poultry tapeworm infection occurs commonly in open range system of rearing because various tapeworm intermediate host and housefly, beetles, earthworm, crustacean, etc. Manure accumulated under cage system serve as good medium for survival of and multiplication of these arthropods intermediate host. Relitina tetragona, Relitina echina, Bothridia devinia proglorina, and Amoebotinia species are common in decibird. Diagnosis of poultry tapeworm. Diagnosis by examining the characteristic passed out gravid segments and contain egg of various species of tapeworm. Fecal examination must be done on fresh faces because the gravid segment migrate quickly outside the dropping. Gravid segment of Cotoguinea species in fishes show bilateral genital pore. Egg of Cynottinia infundibulum have distinct elongated filaments. By necropsy, the adult worm can be found in the intestine. Treatment and control. Treatment. Use of effective anthelmintic like butyrate 75 to 150 mg per kg, praziquantel, nicosamide, albendazole, etc. Control. Keep susceptible bird away from intermediate host. Insecticide may be used for control of fly and ant, control of beetles, earthworm, and crustacean by alternation of range or by spray of diluted phenol. Family Hymenopteridae. List of common and important family member species. Hymenoptera nana, rodent, simian, primate, and man. 4 beetle and flea in case of rodent. Metacystode, cysticercoid in villi of small intestine of man. Hymenoptera diminuta, wild rodent and man. 4 beetle and flea, cysticercoid in intermediate host. Hymenoptera lanceolata, ducks and geese. Cyclops and Diaptomas, cysticercoid in intermediate host. Hymenoptera carioca, fowl, beetle and stable, cysticercoid in intermediate host. Hymenoptera species. Hymenoptera species. Name of genus is derived from the membranous characters of the egg cell hymen, usually narrow and thread-like cystode. Three testes in each major segment. Ovary is lobed and median. Uterus is sac-like, transverse. Egg possesses two membrane. Outer membrane is thin and transport Larval stage cysticercoid. Hymenolapsis lana. Hymenolapsin fraterna is commonly known as draft tapeworm, size 25 to 40 mm long. Segments are broader than long. Hymenolapsis nana is most common tapeworm of man in the tropics and subtropics. Definitive host rodent, simian primate and man. Intermediate host for flower, beetle and flea in case of rodent. Type of metacystode, cysticercoid. Adult Hymenolapsis nana. Reproductive organ of H. nana. On-set reproductive organ per segment, 3 spherical testes and bilobed ovary. Life cycle of Hymenolapsis nana. In man, life cycle is direct, whereas in rodent, the life cycle may be direct or indirect. Man get infection by the injection of egg containing cysticercoid. Rodent may get infection also by the injection of cysticercoid containing flower beetles or fleas. Autoinfection has also been recorded. Cysticercoids hatch out from the egg intestine and develop into adult worm in small intestine. Heavy infection in man may cause anorexia, vomiting, diarrhea, and pain, whereas in mice may cause retarded growth or weight loss. Hymenolapsis nana. Hymenolapsis nana pathogenesis and clinical sign. Heavy infection in man may cause anorexia, vomiting, diarrhea, and pain, whereas in mice may cause retarded growth or weight loss. Diagnosis microscopic detection of egg in feces, serological tests like ELISA, and molecular tests like PCR assay. Treatment praziquantel nicosamide control by adopting personal hygiene. Difference between egg of H. nana and H. deminata. Hymenolapsis nana, Hymenolapsis diminota. Symptoms: infection are most often asymptomatic. Heavy infection with Hymenolapsis nana can cause weakness, headache, anorexia, abdominal pain, and diarrhea. Diagnosis: microscopic identification of egg in feces. Egg measure between 30 to 47 micrometer in diameter, containing an oncospore with an internal cover with polar thickening and 6 hooks. Egg of H. diminuta are longer, 70 to 80 micrometer, and lack the polar filament internal membrane that surrounded the oncospore has 6 hooks on its interior. Treatment: praziquantel or nicosamide. Broadfish tapeworm and spirometra. Broadfish tapeworm and spirometra. Diphyllobothridium, broadfish tapeworm, spirometra. Class: Cotyloda. Order: Pseudophilidae. Family: Diphyllobothridae. Scolex has narrow, deep, weakly spatula shaped muscular growth known as bothrya, as hold fast organ instead of suckers. Eggs are operculated. Life cycle include egg hatches in the environment from ciliated larva. Example: Coracidium. Coracidium enter inside the first intermediate host from procercoid. Procercoid develop into fluorocercoid in a second intermediate host. Adult tapeworm in a vertebrate host. Order: Pseudophilidae. Family: Diphyllobothridae. Diphyllobothrium litum. Common name: broad or fish tapeworm or broadfish tapeworm. Definitive host: man, dog, cat, pig, and other fish-eating animal. First intermediate host: cope- copepod crustacean, Daptomas, gracilis, and cyclops. Second intermediate host, freshwater fishes, pike, barbel, perch, etc. Larval stage, metacestode, procercoid in first intermediate host, and pleurocercoid in second intermediate host. Diphyllobothridium lectum, predilection site, small intestine. Morphological character, scolex has instead of suckers, still-like groove called bothridia and attachment to the intestine. Segments are broader than long. Only one set of hermaphrodite reproductive organs in each proglottid. Numerous testes and vitellia are scattered. Ovary is bilobed and uterus is rosette-shaped. Genital pore present on wide ventral line. Egg oval shape, yellow in color and operculated. Life cycle of Diphyllobothrium lectum. Egg of the lectum are passed out with the feces of infected definitive host like man, dog, cat, etc. First larval stage ciliated Coricidium released from the egg in the water. Coricidia swim in water with the help of cilia and are injected by the cyclops, first intermediate host, where the larval stage procercoids are developed. Infected cyclops are again ingested by the fish's second intermediate host, where the another larval stage pleurocercoids are developed. Life cycle of Diphyllobothridium latum. Definitive host like dog, man, etc. get the infection by the injection of raw or undercooked pleurocercoid infected fishes. Adult Diphyllobothridium latum will be developed in the small intestine of definitive host within 4 weeks after infection. Life cycle of Diphyllobothridium latum. Diphyllobothridium latum pathogenesis and symptom. Less pathogenic in dog and other hosts in comparison to man. D. latum caused macrocytic hyperchromic anemia, pernicious anemia due to deficiency of vitamin B12 occurs in host. Diphyllobothridium latum pathogenesis, pernicious anemia due to competition in absorption of the vitamin B12 between the host and the parasite, as the dilatum present in the proximal part of the intestine. Hence, the majority of the ingested vitamin B12 by the host is absorbed by the dilatum. Dilatum may mechanically block the intestine, abdominal pain, vomiting, loss of weight, edema in feces, etc. Diphyllobothridium lectum diagnosis on the basis of clinical signs. Microscopic examination of fecal sample may relieve the presence of yellow-colored, unsegmented, and operculated egg. Treatment: praziquantel 5 to 10 mg per kg body weight and nicotinamide 75 to 150 mg per kg body weight are effective. Diphyllobothridium lectum control. Treatment of the infected animal. Raw or uncooked fish should not be allowed to be given to dogs. Freezing of fishes at -5 degrees to -10 degrees will destroy the pleurocercoids present in the odor. Pseudophilidae. Order Pseudophilidae. Family Diphyllobothridae. Species Spirometra mansoni. Spirometra mansoni. Spirometra species are almost similar to Diphyllobothridium latum except following. Diphyllobothrium Characters Spirometra diphyllobothrium. Size smaller, larger uterus, uterine coil from a spiral of 2-7 coil, rosette shape, egg, pointed at the end, rounded at the end. Second intermediate host, frog, snake, bird and mammals like pig, man, fishes. Spirometra mansonidae. Spirometra mansonidae. Definitive host. Spirometra mansonidae found in genus of cat, dog, and raccoon. First intermediate host, cyclops. Second intermediate host, water snake, tadpoles, birds, mammals, and man act as second intermediate host. Larval stage, metacestodes, procercoid in first intermediate host, and pleurocercoids infective stage in second intermediate host. Life cycle of Spirometra mansonidae. Spirometra mansonidae. Pleurocercoids. Pleurocercoids of Spirometra species cause sparginosis in man which enter inside the body of man is through injection of pleurocercoid infected host pig or accidental injection of crustacean cyclops infected with pleurocercoids. Spargina pleurocercoids migrate through the subcutaneous connective tissue, causing inflammation, nodule formation, edema, and eosinophilia. Spargina in man is found mostly in the subcutaneous tissue, muscles, and around the eye. Diagnosis and treatment of S. mansonidae. On the basis of symptoms, microscopic examination of feces revealed egg of Spirometra which resembles the egg of a digenetic trematode. Example, oval, yellow, brown, and possess a distinct operculum at one pole of the egg cell. Treatment, bunamidine hydrochloride is effective in dog. Thank you.